Now we go to our reporter, Laura Windsor, who has more on autism.
Roger, a child's pediatrician plays an important role in the early detection of autism spectrum disorders. We spoke to Dr. Koutures at Children's Hospital of Orange County, who gives us more information and explains what autism is.
What is autism? It's a behavior situation where the child is not as interactive. They're not as verbal. They're not as concerned with the surroundings around them. They'll be in a room, there'll be kids playing, there may be noise, and they're in their own world. They're just separate from the rest of us, not able to receive or communicate like most children.
When do the signs of autism usually start to appear?
It usually starts probably early in development. However, we may not pick up the cues until 9, 12, even 18 months because most kids aren't very verbal, aren't very interactive early on. Once we start to expect kids to point, to share, to start to speak, which is about 9 through 15 months, that's when most families start to see something is different. When kids start to play more by themselves and have very stereotypical behaviors, that's when they start to suspect it. So as a general pediatrician, if a family comes to me, usually it's about 15 to 18 months that we may see something is different. The first usual concern is they're not talking. That's usually the first thing that's brought to my attention. As we explore things, we may hear that the child does not point, the child does not make good eye contact with parents or peers, the child seems to like to play with the same toy and do very specific things with that toy over and over. But usually, again, it's that not talking, not communicating the way that other children that they have had or other children they see are doing at that same age.
Dr. Koutures, how is autism diagnosed?
What we do is we screen. There's an excellent tool called the CHOC, which we present to all of our patients at 18 months. It talks about stereotypical behaviors, pointing, eye contact, things that most 18-month-olds should be doing. The family fills it out before they see us, and if there are concerns, it will indicate those. If we have a family that comes in with concerns, we ask more questions, we get a better history, and if we suspect that, yes, this child might have some issues, we refer off to speech pathologist, refer off to behavior specialist, neurologist. What we're learning is the quicker we jump on that child, the quicker we offer resources, that's the important thing. Treatment varies by the issues presented by the child, the family structure. It's probably going to involve some form of speech therapy. There are behavior therapies where you work with a child one-on-one, in some cases multiple hours a day. Social skills, social conditioning, eventually working with other kids in group activities. And again, the sooner you identify, the sooner you try to immerse the child, the better the long-term outcome. We are thinking that there are some familiar structures. We do see cases where we'll have a sibling who will have maybe mild traits and then another sibling have more expressive traits. So there is some thought that there's a genetic basis to it.
Dr. Koutures, what should a parent do if they think their child has autism?
I think a parent should be playing with their child, sharing objects with the child, pointing, talking. If at 15 months or so they're not seeing that reciprocal behavior, that child's not sharing toys with them, not making eye contact, perhaps has very few or no words at all, then yes, take them to their pediatrician, express their concerns, work with their pediatrician. I wouldn't try to self-diagnose, I wouldn't stay up late worrying, I would get trusted help, get it early. Better to make that call, get that evaluation, be told minimal or no issue. Even if there is a bigger issue, you've started the process early, again, the better long-term outcome.
If your child shows signs of autism, contact their pediatrician to get the proper tests taken so your child can grow up as healthy and happy as possible. For the American Health Journal, I'm Laura Windsor.